start with figuring out what does health look like for me physically, mentally, emotionally, and work really hard on being good at you.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
Love music and love life. This is Smooth 98.1. You're very welcome. Every Saturday from 8 till 8:30, we talk about your health and wellness, and we call the show Soul Food. So if this is your first time, hey, you're in the right place for you to get educated about your health and specifically your eyes, because the eyes are not just the windows to the soul, but it is your light, really. You don't want to walk about in darkness, especially if that darkness, literal darkness, can be prevented. So I told you earlier that this week, 10th to 16th of March, is known as the World Glaucoma Week, and it's to raise awareness about glaucoma. So this year, it is known as, the theme is uniting for a glaucoma-free world, and it begs the question: is it achievable? Can we achieve a glaucoma-free world? But don't worry, we will get into that as well as every other thing that interplay and what causes glaucoma and how you can prevent it. So, as my guest this morning, I have a consultant ophthalmologist, one who is not new to us at all. She's been here a number of times, and we're grateful for her presence. She is Dr. Dupe Olorunnimbe. Good morning.
Good morning, Sharon. Thank you.
Thank you for being here. And how has the drive been, the advocacy as well as the education?
Well, every year we're here, we have the Glaucoma Awareness Week, and ophthalmologists and eye care personalities across the world do eye screenings, they do awareness programs just to make people aware of this really, really horrible eye disease and preventable too. So prevention is better than cure.
Yep, less expensive too.
Yes, and screening means that you get to know what you have at an earlier stage rather than wait for a late presentation. And as long as you are detected early enough, we believe that you stand a chance to preserve your vision. What glaucoma does is to progressively lead to blindness in a painless way. So that's why we call it sight, the silent
thief of sight. Yeah.
Yes, and it's just so poor that because it is painless, many people are not aware that they have it. In developed countries, 50% of people go around unaware. In developing countries, 70% as high that go around unaware that they have it. And we have an estimated number of 77 million having moderate to severe glaucoma worldwide. And that's a 2020 figure. It increases every year. By 2030, we're looking at 95 million people possibly having it. So what can you do? The trick there is to know who your enemy is, how far the enemy has gone, and how you can curtail the enemy. So when we're talking about unifying, apart from the advocacy, we are the eye care team is unified already. We have one focus. Let's try and conquer glaucoma. So the ophthalmologists, the optometrists, the ophthalmic nurses, and any healthcare policy should be geared towards that. But what we don't know is how much impact we're having in the policymakers. How much aware are they that we need to actually unify on this? It's one thing to have the foot soldiers. It's another thing to have government coming in and aiding all those programs. More importantly, unifying, we need to be united with the people we're trying to save their sights. Because it's a painless condition, you don't get to tell someone to come and check his or her eyes. We tell you, I can see. Because that's how glaucoma is. It creeps up on you. And we need this awareness talk is also to seek the public cooperation with those of us that are trying to fight glaucoma on their behalf. So unifying to have a glaucoma-free world is achievable, but it's also a tall order, as we have too many people to convince that they should have their eyes checked.
So the data is interesting, like you have already mentioned, that maybe in 2030 we can have about 90 something million people, and according to projections, maybe in 2040 we can have about 101.8 million people with glaucoma. Now, since we are in the business, at least for now, we're in the business of fighting glaucoma and trying to achieve a glaucoma-free world. So let's say, what do you think, in how many years can we possibly achieve a glaucoma-free world? That's one part of the question. And number two is, you've already started it. What does it take to achieve a glaucoma-free world? You already mentioned uniting. So the government unites with the people, the healthcare workers, the professionals, the consultants, everybody unites. But what are those things that need to be in place for us to achieve a glaucoma-free world?
Oh, well, good eye care in all our communities. So number one, the numbers are skewed. We have fewer health workers every year or every month because of the Japa syndrome.
Yep.
We also have a growing population in our country. So the ratio is already skewed. But then the little amounts the little number of people that we have are working hard, but we need backing of the government. We need maybe more money pumped into eye care, and everybody will say, "Oh, she's only talking about her field." The O&G people will say they want more money too, but that's just the truth. Because we go right down to the communities, and you see about glaucoma, the earlier you detect it, the better a chance you have to prevent blindness. There's control for glaucoma, but there's no cure because we don't know what causes it. That's number one. It's painless largely. Number two, and we have about the vision loss is from the side. So you're looking straight ahead and you actually feel you can see that you have no problems with your eyes. They're not red, they're not painful. But the constriction comes in from the side view, from the side vision. And by the time you notice with medical equipment that, oh, I can't see, 50% of the vision is already gone.
That's
so how do we do it? What we're saying is get your eyes checked. Get your eyes screened. It's not just about getting glasses. It's about listening to what your ophthalmologist has to say. The treatment depends on the situation of a patient. Treatment depends on what is available. We have drops, we have surgery, we have laser. But the ophthalmologist is able to determine and advise you on what your course of treatment should be. If it is drops, then you have to be on drops for life. If it is surgery, you have to gear up and not be fearful, because there are a lot of myths. People say, oh, they go into surgery and they come out blind. No, that's not. There's always a reason for everything, and just obey the instructions that are given if you have to do surgery. At the end of the day, the eye care personnel are ready to do their bits. Look, you know what? Year in, year out, not only for Glaucoma Week, we have eye screenings all over. I can say in Lagos State that all the eye care teams, optometrists, the ophthalmologists, the ophthalmic nurses, we work together. That is amazing collaboration. If we can sustain it and do something every month, just in our state alone, I believe that we will, we're heading towards unified. We're already unified as the care providers, but we even need the people coming out to listen to what we have to say and to subject themselves to the tests.
Let me put you on the spot a little. So I want metrics. I want to find that little glimmer of hope that progress is being made. So as compared to the previous years when this thing started, because I know you've been in this for so long, this advocacy, this gospel of high health and education. So compared to those years, maybe last year, 2 years ago, 10 years ago, and now, what are those metrics of measurements that you can say, yes, we're making progress when it concerns healthcare or eye health in Nigeria or in Lagos?
Well, from my own experience, I get more people coming in and saying, can I come for an eye test? I'd like to screen my eyes for glaucoma. And I'm like, really? Yes, actually voluntarily
Nobody
submitting.
dragged you.
Yes. And a lot of that is happening. And then they tell you, oh, I heard somewhere on the radio, oh, I saw a group of people, but there were so many I couldn't. I'm just coming in now for an eye check. And so in terms, I may not have absolute numbers, but the knowledge is getting out there. People are subjecting, people are even asking if you can check for glaucoma in their children. And rightly so too, because mainly open angle glaucoma happens 40 and above, but we have children that are born with glaucoma. We have children that in their childhood they have glaucoma. So those ones, I mean, it's a raw deal. If you don't look up for them, a child doesn't know how we're supposed to see. A child would have to be tested to know that he's not seeing well.
I maintain my absolute hatred for conditions that don't have that scientific or medical explanation. I hate it. Because I was about to ask, is it genetic? And then I remember you said we don't know what causes glaucoma. So how do you?
Exactly. So the more reason why we should, we should actually test for it. Go out actively and test for it. The person who discovers the cure and the cause absolute for glaucoma will get a Nobel Prize, I'm sure. And the truth of the matter is, so many angles have been explored. We're told that glaucoma in the Africans and African Americans is more severe and more relentless than the ones in the Caucasian. So there has to be some genetic connotation there. Is it something we eat? We're not sure. But people have gone right down to the cellular level, to taking a cell and looking at it. There are a lot of associated factors. Some people are saying glaucoma is actually a brain disease. They've gone so far, they're just trying to look for the cause. But while we're waiting for that, we are also, I mean, there's development of drops and everything for the control, so that it does not always have to lead to blindness. The blindness is irreversible, and when a grown and active person is blind from glaucoma, you can imagine the economic burden even on the government. A blind man in our country needs about 3 people caring for them, leading them back and forth. In the developed countries, they have a guide dog. We don't have all that. So for us here in Africa, we really need to be able to do everything possible to prevent blindness, and that starts with the individual, not even the doctors at this stage.
Oh wow. Well, if you're joining us for the first time, this is Soul Food right on Smooth 98.1, and we are talking about glaucoma right here. It's World Glaucoma Week. We are educating year in, year out. We do this so that a person can at least take heed. You know how they say that faith comes by hearing. So repeatedly, when you hear this, maybe one day you will get yourself off the couch and go and make a check, or you just take heed on these things. So we're talking about glaucoma. If you have any questions or there is something you'd like to say, WhatsApp line is 0809 444 0981. Again, the WhatsApp line is 0809 444 0981. And the call line is 01 448 9981. Again, 01 448 9981. My guest is Consultant Ophthalmologist, and she is Dr. Dupe Olorunnimbe. Let's go over the risk factors again and those possible things that, yes, you don't know what causes these things, but there are some actions, some habits, and some things that you do that might increase your chances of developing this. But before that, let me quickly take this call. Hello, good morning.
Hello, good morning, ma'am.
Good morning. What's your name and location, please?
Yeah, my name is Osaro, calling from here.
Thank you for calling. Do you have a question?
Yes, ma'am.
Please go ahead.
Last 2 months, I went for eye test, because I couldn't see far. It will look as if, especially when I'm inside the sun, it looks as if I am seeing white. I can't see clearly. So I went for a test. They said they couldn't find anything. So since then, I've been praying. I've been trying to see some remedies to fix it. I don't know what to do.
Did you go to an eye clinic?
Yes, ma'am. That's where I went for. They said I can only do the surgery,
Okay, so they
and
found
I'm
something.
afraid.
So
They
they
can't
found
find
something.
any test, anything.
No, they found something. Otherwise, they would not have told you that you required surgery.
Okay.
Are you getting me?
Yes, ma'am.
One thing I'd like our listeners to know is that you have an absolute right to ask questions if you don't understand your line of management from your caregiver. Because he's saying that nothing was found. They told you
Yeah.
something. Can you remember what it is? Because they
So,
can't offer you surgery if you don't have
okay.
anything. So
But he just told me that he said the doctor said the white is covering the black.
maybe
That's
that's a
what he just told me.
cataract. Maybe that's a cataract, and that kind of blindness is temporary and unavoidable. Is avoidable. It's avoidable. You don't have to not see. If it is cataract, then you need to see a doctor. Go to start. I don't know where you went, but you really need to do the surgery if it's a good place. You can try any of the general hospitals. There's a
Okay.
large crowd, but there you will
Okay.
understand what they're saying and why they're doing what they're doing. You need to be able to ask questions.
Question.
What is the name of
Okay.
the condition? Cataract,
Okay.
glaucoma, whatever, pterygium, whatever.
Okay.
Okay, sir.
I'll do that.
Uh,
You advised me to go for general hospital.
Yeah, well, because you've gone to a clinic, I'm not going to ask the name of the clinic, but I don't know what it is. I don't know what they're saying to you there. You understand? Because you have not
Yes.
given me a full detail. If you
No,
say, yeah,
they said it's not glaucoma. It's not the other one you mentioned just now. But
cataract.
yes, she only asked me if something fell into my eyes. I said I can't really remember, and they gave me eye glass to test, like three of it. I couldn't the same thing. I couldn't see it far.
You need to ask or go to seek a second opinion. Always seek a second
Okay,
opinion. You can get an
okay,
opinion from a general hospital. Thank you.
okay. Thank you.
all right, we wish you all the best. Have a lovely day. 014489981 is the number to dial. 014489981, and the WhatsApp line is 0809444091. So if you'd like to call, that's the number, and if you'd like to send a message, 0809444091. I think it's very important that, again, like you said, it's very important for people to ask questions.
Yes.
There should be no secrecy with your health. You should, unless I don't know if there is any condition that will ever make the doctor not disclose the condition to you. Is
No,
there?
no, it's your right to know.
So please ask questions and know what it is that you're dealing with. In fact, when they do not tell you what it is you're dealing with, that is more reason why you should leave
Seek a
that
second
place.
opinion.
Yeah, because you need, I don't know. Anyway, so if you have any questions, yes, and I think it's always good to go to a place where you have specialists, and I think
Yes.
the easy place to find that are the general hospitals.
We're actually blessed in Lagos State to have quite a few with eye clinics.
So please go to a general hospital, seek not just one opinion, two, three, four, five opinions, because this is your eyes we're talking about.
True.
It's very important. All right, back to the conversation. We're talking about the risk factors for glaucoma. So again, we've mentioned that you don't exactly have a definite cause that we can place our hands on, but what are those things that you can do? Maybe it's even what you're eating that can increase the chances of glaucoma.
Okay, we call them risk factors because in many situations we found that it's a common habitat. So glaucoma is said to be commoner in the age 40 and above, but I also say that that's not exclusively right, because you can find glaucoma in little children and in young adults as well. Glaucoma is commoner in the black Africans and African
We've
Americans.
seen a lot.
Yes, we have. glaucoma is, I won't be surprised if somebody with diabetes has glaucoma. Diabetes mellitus is a risk factor. Hypertension is a risk factor. Then people who are short-sighted to a high degree are more prone to glaucoma.
Why?
People who have,
Well,
yes,
again, no costs, no.
yes, it's about the the arrangement of the eyeball there. It's just something that was discovered. It doesn't mean that people who are long-sighted do not have. In fact, yeah. So what we just want is to get the eyes checked, because if you have, we say another reason why we should be talking about unifying for a glaucoma-free. If you are a physician that takes care of hypertensive patients, of diabetic patients, at some point annually you must send them for a comprehensive eye check, because there's no point actually controlling the diabetes and keeping the person alive and the person goes blind from glaucoma. Do you understand what I'm saying? And there are so many things that can happen to the eye too in diabetes. So we also talk to our other colleagues that please send them for annual checks. It's all part of unifying. This unifying is a very wide, unifying for a glaucoma-free world is a very wide range of events that can happen.
All right, so what are some of those hurdles we need to get out of the way for us to be truly unified in fighting against glaucoma?
Well, maybe we should stop being territorial about our specialties, something like that.
Interesting.
And then we should also get the listening ear of the federal government, the state government, the local government areas. We can, at every level, we should have somebody speaking for us. But we've taken leaps and bounds. We now have a national eye policy at the federal level, and that way it filters down to the states. Eventually we will be feeling that, but we just want more. We just want more, because we're talking about vision, we're talking about sight, and that's it. So what else can we do? People, come out and get your eyes. Give yourself a birthday gift. Just take your birth month. It doesn't have to be the birth date, but the birth month, and tell yourself every year in the month of March or in the month of April, the birth month, that you should check your eyes. You don't have, glaucoma is symptom free. Sometimes the first thing people notice is that they didn't see that Okada jump in front of them. They're even a danger to themselves and to other people on the road, because you're not seeing from the side anyway.
Blindsided, literally.
Yes.
Wow. I have a message from Chidozie on Instagram who says some Nigerian doctors don't like being asked questions because they are doing guesswork, thereby gambling with people's lives. If you see that, run for your life.
That's a sweeping statement to make, then. That's a sweeping statement. If I want to ask my doctor what he or she is doing with any part of my body, there's a way I would ask it, not in a rude way. I had a patient who sat and I said, how can I help you? What are your complaints? He said, I really can't see, and ChatGPT told me that this is it, this is it, this is it. So therefore, he had already done some research, which is good, and he's telling the doctor, this is what I expect you to do. I had not even finished taking the history. So and not many doctors know how to handle that. You can just, so I just smiled and said, perhaps we'll ask ChatGPT to treat you by himself. But can you then tell me, and then we went on to have a long conversation, and then he found out that he misinterpreted or he mistyped in what question he wanted to ask when you didn't even know what the diagnosis is. So it depends on the tone. Many doctors are happy to explain. You know why? It makes their job easier. If the patient knows where I'm going and what I'm planning, it makes the patients more comfortable and my work easier. So I think it's very wrong for him to
Generally.
say most doctors don't like.
No, he said some
Some
Nigerian.
Yeah, some, no, we like to explain. You got it wrong. We like to explain.
All
And,
right.
and you know that in some places there's also a counselor waiting. So even if the doctor does not have time to answer all your questions, there's a counselor that's going to talk to you if you're going to have surgery, if you're going to go blind, there's a counselor. Some units have counselors that will talk to them, answer all their questions. That one, there's no time, but the doctor is pressured. Doctor has like 100 patients to see in 2 hours or so. You're talking about chat GPT. So
Now, as someone who has been in the health sector for a bit before I jumped out of there to come and do health advocacy
yeah,
on radio, this is something I always say. You need to be honest. As a patient, you need to be honest.
so that's true.
You need to tell them the truth, because at the end of the day, both of you are unifying for your health. So when they ask you, they can only make diagnosis based on what you are giving them the information. Yes, they will run tests, but it's something that will inform the test. So if you had a cup of wine or 3 cups of wine, tell them you had 3 cups of wine, not 1 drop of wine, because that can taint the whole thing. So please, when you go for this test, when you go for clerking, please tell them everything. It will make the job easier.
You're very right, Sheon. I've experienced that all the time. For glaucoma, there's a particular question that we have to ask because it tends to run in families, but we don't know the pattern of inheritance. One of the questions we say is, has anybody been blind in your family, whether in old age or anything? Did you hear that some people, they say, oh, like
God
never,
forbid.
God forbid. What is it? If you ask the same question in another way, and you ask it 5 times in 5 different ways, finally you will say, oh, I think it's even in the family of the father, if it's the mother talking, as if
Yeah,
not
not a
us.
part.
Yeah, so things like that, you have to actually give the information for us to be able to work.
Thank you. Cisco Delgado on WhatsApp says, is it possible for a diabetic patient to become blind all of a sudden? And then he further goes to say, I think Chidozie is correct. I've seen a medical doctor who always uses Google search engine to check remedies for ailments. We now call him Google Doctor.
Really? maybe he's using AMR. If nowadays many of us are using AMR, so we're on the laptop while you are talking, and we're inputting that's not a Google search. That's putting your data into the electronic medical records. That's it. Many people are using electronic medical records now. So he may not be Googling, he may actually be writing your stuff down on it. So that's hard to say. What was the first aspect?
Is it possible for a diabetic patient to become blind all of a sudden?
It is. It is. If the person has the diabetic eye disease that leads to retinal detachment, it will be a sudden thing.
Okay.
It can be gradual, but that will be a sudden thing.
Good morning, ladies in the house. My name is Effiam Antiya from EJ Police Barrack, Lagos. Please, I want to know what happened because I did a pterygium surgery some times ago in one of the government hospitals, but right now the same pterygium is growing again. Please, what can I do to stop it?
Okay, pterygia, that's a plural. They occur because some eyes are more sensitive to dust, to bright sunlight, and these are things that are uncontrollable. So if you go in for pterygium surgery, I'm sure many people say, you know what, it might recur later because you are still in the same environment that caused it in the first place. Not everybody is that sensitive to the bright sunlight and to the dust that flies around. However, the science is developing more drops and more of anti-recurring processes. And one of the things is that pterygium surgery requires 6 weeks of eye drops, by which time the patient has already gotten bored with it because the patient is not feeling any pain. At some point, you are putting in drops every 2 hours. Many patients can maintain that, but that's what it takes to fight the recurrence. But we say this, but then what happens at home is also different. So there are two things. It might be the environment and your makeup, constitutional makeup, and maybe that you actually didn't follow all the instructions properly.
I'm tempted to ask you live on air if we can talk about pterygium as soon as possible. Not today, another time.
Yes, fine.
It could be
Yeah.
in 2 weeks, a week, depending. You could
Yes.
join us on Zoom because this is something that actually is common.
It is.
You find it in a lot of people's eyes and they just think it will go. They think it's that discharge that, the one you wake up with sometimes and they can clean it away. Yeah.
Okay, I'd like to hear what people think of it. It's a fleshy growth that comes from, your the side, the nasal side of your eye, and keeps growing outwards in a wing-like manner. But you know that once it encroaches on that black circle, it goes on and on and on, and it's very difficult to get it off at that point. You can get it off, but you can leave a scar on your eye, and then ultimately it will affect the way you see. So maybe, yeah, I'll be glad to talk about it, Rachel.
Thank you very much. And on that note, we've come to the end of the show for today, the 16th of March 2024. It's the last day for the Glaucoma Week and it's been educating. You can find this video on YouTube so that you can share with your family and friends. Get further educated on glaucoma, and importantly, please go check yourself. There is no age limit for checking yourself, right?
No, not at all.
All right. And then the question of consulting the right professionals, also allowing them to do their job. But if there's something that I would like to point out, I think emotional intelligence is very key,
You're right on that.
both on the side of the patient and
You're
the side
right.
of the doctor.
I agree.
So please, as you're questioning your doctor, be emotionally intelligent, be intelligent. And as a doctor, be emotionally intelligent about giving answers. Understand that people are concerned about their health, right? And they want to know. So outrightly shutting them down. There are times that people don't know better. They just came with what they know. And there are people who they would rather Google their information first and come and tell you, this is my diagnosis, stamp it.
You know what? I think that everyone, whatever approach they have to asking questions, they're coming from a place of anxiety and fear. So what I try to do, you have to allay their fears. You have to understand that anxiety. It's natural. So you have to play along with what they present with.
And importantly, I think this is the part where I give a shout out to all the healthcare professionals, the ones who are still in Nigeria, who are almost swimming against the tides,
Thank you.
who are carrying so many people on their backs, who are still being committed to the lives and to saving the lives of people and bettering their health. Thank you so much for what you do. Thank you for your service. Thank you for your sacrifice. Thank you for your education. Thank you for not giving up on Nigeria and her people. We possibly cannot repay you. We can't pay your salaries. We can't fully thank you, but we just want to say thank you for all that you do. On that note, thank you, Dr. Dupe. It's
Thank you,
been a
Shem.
pleasure always.
Thank
Are you now active on social media?
Oh, yeah. Yes, I think I will. Yeah, I'm working on it.
We keep saying that every time.
At that time, I was in government employ,
Oh, okay.
but now I'm no longer there, so I'm free to.
You're right. Okay. All right. Do you have a social media handle?
I'll tell you next.
All right, thank you. On the other side, it will be the show with the children from 6 to 15 years of age. That's the age limit. And they can call. I think they should start dialing the number now because you know how the network can be. 014489981. Start to dial the number so that you can get in time and be a part of the show. Stay with us on Smooth 98.1.
Will follow.
We start with figuring out what does health look like for me, physically, mentally, emotionally, and work really hard on being good at you.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
My name is Adenike, actor.